Dental bridges are a typical dental procedure that replaces tooth loss. What is the average time dental bridges usually last? In this clip, we'll explore the longevity of dental bridges as well as the elements that influence the longevity of bridges, and also strategies to extend the life of your dental bridge. 1. What exactly is a bridge made of dental? Dental bridges are a prosthetic device which is utilized to fill in the gaps created by the loss of a tooth or teeth. It is composed of several artificial teeth, referred to as pontics. They are held with crowns that are bonded to natural teeth and dental implants. Dental bridges can be constructed using a variety of components that include ceramic, porcelain, metal, or a combination of these. 2. Dental bridges have a lifespan that is longer than the lifespan of a human. The life expectancy of bridges for dental use is 5 and 15 years. But with the right care and routine maintenance, dental bridges could last longer. The lifespan of a dental bridge is contingent upon a myriad of aspects that include the materials used as well as the habits of oral hygiene of patients, the state of their surrounding teeth and gums, as well as the skills of the dentist who put the bridge. 3. Certain factors can impact the durability of dental bridges. Many factors influence how long an implant lasts. They include oral hygiene. Good oral hygiene, such as regularly flossing and brushing, is crucial to ensure the condition of your teeth and gums that are supporting the dental bridge. A lack of oral hygiene could result in gum disease and tooth decay, which could cause damage to the bridge. Material. The type of material employed to construct the dental bridge may also influence its durability. Ceramic bridges and porcelain look more attractive, however they could be more susceptible to cracking or chipping as in comparison to bridges made of metal. Metal bridges, on opposite, tend to be more sturdy, however they may not be as attractive visually. Bite force. An excessive force applied to the dental bridge caused by grinding the teeth or clenching them could damage the bridge as well as the surrounding teeth. The patients that grind their teeth could require wearing sleep guards to safeguard their bridge during sleep. Dental hygiene. Regular cleans and dental exams are necessary to ensure the condition of your teeth and gums that are supporting the dental bridge. Dental professionals can spot concerns early and provide strategies to stop future damage to your bridge. 4. How to prolong the life of your dental bridge. To prolong the lifespan of your dental bridge, be sure to follow these steps. Maintain good dental hygiene. Brush your teeth at least 2 times each day, as well as flossing daily to eliminate food particles and plaque, which could cause dental decay as well as gum infection. Beware of sticky and hard foods. Avoid eating foods that are sticky or hard that could damage or break the bridge of your teeth. Make use of a night guard. If you're grinding teeth in the evening, use a night guard that protects the bridge of your teeth from being damaged. See your dentist on a regular basis. Plan regular dental exams as well as cleanings to maintain your dental health as well as gums. Also, it helps to spot any problems with the bridge that you have made with your dental. The lifespan of a dental bridge may depend on many variables, but with good cleaning and regular maintenance, bridges for dental use are able to last for years. When you adhere to good dental hygiene routines and taking the necessary precautions to guard your dental bridge, you'll be able to get a stunning and reliable dental bridge for a long time to come.